We were part of the pilot project, and I integrated actually into two different courses. So the first was a 400 level, or what for our senior illness course, and we cover a variety of topics in that course. It actually covers some psychosocial, higher level, as well as multiple med-surg type topics. And so within the course, I aligned the case scenarios with those topics that I already had planned, previously planned in the syllabus, and I normally cover. And then I assigned them as homework. So my particular courses, I do flipped courses generally, and so for homework, they're generally looking at videos and doing some practice questions. And I had considered doing the case scenarios in class, like I often do activities in class with cases. But with these, I decided to utilize them as homework. And my rationale for that was because I saw the multiple links that were available, I really looked at them as an exceptional way for students to improve their own learning. And sometimes in a classroom, there would be limited time and we wouldn't be able to click on all the links. And sometimes when we're doing a case together, I think there are some students that participate fully and really get more out of it. Whereas in this situation, every student was able to complete the case on their own, at their own pace, and click on the links and learn more that they particularly needed. So I found that really helpful. And then what I did is student had to complete the summary evaluation and submit it to me. And I was able to review those. And it was so helpful in helping me identify weaknesses within the class. And not just me, I have a colleague here who also did that. So I had my students do one on anorexia, and I found out that they really did not understand some of the medications that can be utilized in that management of anorexia. My colleague had an example that I thought was really excellent to show how this was so helpful. She had the students complete at a 300 level the congestive heart failure scenario and submit it. And often in class, we'll say, what are the signs and symptoms of congestive heart failure? And students will say orthopnea, shortness of breath, and fluid gain. But it was so interesting that there is, in the history of the CHF scenario, it says I'm sleeping on, I think, 2 pillows or in the recliner. I can't quite remember, but students did not highlight that as significant. So it really showed us that although they can list the signs and symptoms, that they could not translate that to what a patient might say in clinical practice. So we found that super helpful to look for potential weaknesses. And then we covered it deeper in class. Like, I see this as a weakness. Let's talk about what orthopnea is and how a patient might talk to you about that to recognize that symptom. The other way I integrated it is I teach an NCLEX review course in the spring for our 400 level. And I had some students that were not performing to where I felt like they needed to. So I utilized it with students that needed additional attention, and we would go through the cases together. And it helped me to evaluate where they were missing or where they had weaknesses in critical thinking and in clinical judgment. And I was able to utilize with them how to work through those next gen type of questions.